Good afternoon, everybody. Welcome to School of Health Sciences Virtual Open Day Talk. My name is Prof. B.Y. Chin, and my speaker here, the Dean of Health Sciences, Prof. Winnie Chee, right? So before we go on, let's have a few housekeeping rules. We all have muted your microphones because we need Prof. Winnie to talk a little bit more without interruption. And for questions and feedback, please use the Q&A panel. And I will then relay the questions to Prof. Winnie towards the end. And of note, this live webinar will be recorded, right? So if you have any reservations, please do put it in the chat and we will take care of that. Okay, let's look to the next slide. All right, so the title of today's talk is Adapting to the New Normal at IMU by Prof. Winnie Chee. Prof. Winnie, please take it away.
Thank you so much, Prof. Chin. So Prof. Chin and I, good afternoon to everyone. Good afternoon to all the students and parents who, thank you for spending your roughly about 1 hour with us on a Sunday to find out more about what we are doing at the School of Health Sciences at this moment, especially with the current pandemic, and what we have been doing to ensure that the students under the School of Health Sciences still continue to have a very enriching experience in their teaching and learning as they go into the different professions that they are going to study in our school. So Prof. Chin and I are both, Prof. Chin is the Associate Dean for Research and External Affairs, and I'm the Dean, and we both work together with Dr. Anna, who's in charge of academics, and with all our program directors to make sure that all the students still have a fulfilling experience in School of Health Sciences. So for those of you who may not know, Health Sciences in IMU actually has 6 programs that we conduct. They are 5 of the programs are at the undergraduate level, so that it's the Biomedical Science Honours degree, Bachelor of Science in Medical Biotechnology with honours, Nursing degree with honours, and Dietetics with Nutrition degree with honours, and Nutrition degree with honours. And we also have a postgraduate diploma in Diabetes Management and Education, which is at the postgraduate diploma level. And those are more for learners who wish to get more experience in managing diabetes. So I will focus a lot more on the undergraduate courses, of course, because I think this is of interest to all of you. Right, so as you know, the pandemic hit us in March 2020, and that was when IMU, all the deans, all the school deans got together with the senior management and said, okay, the students cannot come into campus, so what about it? And this is what we have done. So there are about 6 different things that we have done that I want to share with you to ensure that teaching learning continues to be a good experience, and none of our students are jeopardized by the pandemic in their teaching learning at least. So the first thing that we did was we knew that we have to convert all the lectures and all the classes into online. So maximize learning, but at the same time we need to engage with our students, because in the class we can always see them, we talk to them, we hear their challenges, we can answer their questions. So how do we ensure that we still engage the students when they are already going to online? Okay, so for potential students who are coming into Health Sciences program, this is what you're going to experience. The first thing first is on our Moodle website, you will find online lectures already pre-recorded and live on the Moodle website. So all lecture topics are being pre-recorded, and at the same time we will deliver it either synchronously, like what I'm doing to you now, right? So this is a synchronous lecture, or it's an asynchronous lecture of which I already pre-record my lectures and I will put it on Moodle. Okay, so there will be a timetable to tell you when you should be listening to those pre-recorded lectures. But at because we want to engage with you, we will conduct the same topic but as flipped classroom. So for example, you have already listened to my lecture about, let's say, what is the role of nutrition, and then I will have a live session, which is a flipped classroom, where I will, we will be discussing some case scenarios, or I will be doing some quizzes with you to make sure that you enhance your understanding of that topic. So online lectures, live as well as flipped classroom, we will still continue our problem-based learning style of to ensure that our all of you have critical thinking skills, but that's going to be on the e-platform, right? So the lecturers are there and the students can post their questions and they will also meet among each other because we will form online groups for you to have your discussions, and then we will have a face-to-face meeting with the lecturers online. So what I find that is amazing about this is that we can have actually a lot of small group teaching. Okay, students, so let's say we have 50 people in the class, you're broken up into groups of 5 to 8 or sometimes 10, and you will have a one-to-one with the lecturer. Okay, so this kind of small group teaching is very useful because that's the time where you can actually ask questions, and we actually have a very enjoyable session in teaching all of you when we are doing this small group. The only difference is I may not see you, we may not face to face, but we are seeing each other online, right? So that is what we are doing. Now, what about practicals? Because most students are also concerned about practicals, right? Because if I can't go to the lab, how do I ensure I get my skill? So we have actually converted practicals into virtual practicals. So for example, you can see here, this is for biomedical science, as this is Prof. Tony. He has done a recording. He's teaching histopathology. So he has done recording using slides, using examples, so like nursing. They're talking about, this is showing how are they going to do, how do you resuscitate patients, for example. And then there's also, even in the lab, there's actually live video recording of how to go about doing the laboratories. And all these micro learning videos, the school has done about 50 over micro learning videos across the different program. And you can always watch and rewatch it again. Okay, so you're not going to miss out on those practicals, and you're given that you will then still, based on what you have learned from the videos, you will need to write a report based on real data that we're giving you. Now, this is of course to prepare for the practical, but it doesn't mean that you will not have a chance at all to go into those classes at all. So as you can see, besides the online learning, the next thing that we are doing is we are also prioritizing the real world experience. So what do we mean? So what we mean by this is because guided by the Ministry of Higher Education. So when the times during MCO, when, remember if we going now is phase 1, they are still allowing, especially essential skills to be done face to face. So here you can see this is for the laboratory sessions where we follow very strict SOP. So all students have to wear masks. They keep a 1 meter social distance, right? And maximum, we only allow 3 students per bench. You can see here, there's enough adequate SOP put in place. So for those students who they need to do the essential skills, so you cannot just watch video to do your practical skills, right? So we are actually covering it already. So some students in semester 1, if there are essential skills they need to do, but at that time we couldn't come into the lab. They watch the micro video, they do assignments based on that. But the second semester, we make up for it. So they still go to the lab and they still get essential skills, right? And for final year students, they are actually priority. That's why we prioritize them. And for final year students, so that they can graduate on time, they can still do their final year research, even though it's in the laboratory. Okay, now what about internship? Because internship is very important, right? This is part of the strength of the health sciences curriculum. All our students in all the program, they will have some form of real world experience, even sometimes in the early semester, towards the senior years. Now, we have actually not stopped any of the internship, right? So what have we done? We have actually discussed with our industry partners to do virtual internship. So actually, I think we are very fortunate that we have very good industry partners who really want to support the students. So you can see here in the video over here to your right, this is a virtual internship that's happening. So these are the students, and then they have their who are in their offices. So how do they do this? So the virtual internship means that the industry partner actually guide the students through data, right? So for example, in a laboratory, they need to look at certain quality aspects and analyze some of the data, which is real world data. It's not data made up by the lecturers. So then the industry partner give the assignment to the student work on the data, and they have this live session where they'll be training the students on real world, meaning that these data eventually will be used back by the industry partners for their work to continue. Okay. Now, wherever possible, they still go into the labs for the industry, but maybe not every day, but they may go once or twice a week. So they still get that hands-on experience, even though it's virtual. Okay. Now, for other kind of more community-based programs like dietetics, we actually make them go through real communities. So they'll be actually conducting webinars on topics that real patients and the community out there can tune in using the social media platforms, and they still get real questions from the patients and from the community that they're interacting with. So in this way, our students actually don't miss out a lot on their internship. And even though they do the virtual, I like to let you know that whenever, right after, if you are able to open up, we actually make sure that the students have the hands-on after that. So no students are actually left behind in the sense that they only did virtual and they never got into real world hands-on. They still do when the government allows them to do it. And we're still able to do that without having to stretch that they need to stay back. They still manage to graduate on time. Now, the third thing is, because as part of a student experience, you not only need to learn in the classroom, you also still need to be going to conferences, you need to present in conferences, scientific conference or clinical conferences. And you can see here that all our programs in health sciences, our students actually do participate, and they even organize conferences. So they are outside classroom experience, which is their experiential learning and the skills that they have, leadership skills, team working skills, how to organize conferences and projects. They don't miss out on it. So here I show you is a group of students in biomedical science. Actually, they managed to, we still managed to host the 11 Malaysian e-symposium on biomedical science, which are all attended by biomedical science students from the whole of Malaysia. And still we are able to do that, yeah. And they even have won competitions, so they have won prizes in these conferences as well. Here you see the dietetics students has won the best oral presentation first prize. This is a final year student in one of the clinical conferences that she attended. And even by medical biotechnology, nurses, the students still have the same experience, except that the community they work with or the people who participate are on the Zoom platform instead of physically in IMU. Now, what about mobility? Because one of the strengths of health sciences program is, especially in biomedical science, in dietetics, even in nursing and medical biotechnology, they actually manage to go to other countries for their mobility. Now, around the world now, a lot of, most all our countries are they have shut their borders, but they have not shut the online border. So you see here that the medical biotech program, they actually did a virtual science internship with a group of universities and our partner school from Australia, and they did a project together. So it doesn't stop them interacting with people beyond the shores of Malaysia. And similarly, the diagram at the bottom you see there, now that is actually dietetics program, and our students were sharing case discussions with their dietetics students counterpart in India. So you can see it's quite amazing. With the current crisis, it's actually totally transformed how we learn and how we teach in health sciences, because the students doesn't stop the borders, even though we can't physically fly them. In fact, it opened up even more opportunities, because now with online, there is no cost, you don't have to buy a plane ticket and all that. And almost you can engage with everyone in the world now, which at a very cost-effective manner. So the students have not lost out even in terms of student mobility. Now, of course, another important point is the lecturers need to be ready. I know young people, the students, they are all very tech-savvy. Some of us lecturers, it's been, we're quite senior, we don't always go online, we don't always use the technology and so on. But even I myself, Prof. Chee, everyone, every faculty, now we have all undergone compulsory courses that we must do to enhance our faculty digital skills. So thanks to departments like IMU eLearn, as well as our Center for Education, they made sure and prepared a training for faculty. So now even in my own class, I've been like 30 years in the business already, teaching and learning. I'm now learning all these new tools to engage with my students, and I find that very fulfilling as well. Right, so it's fun, so the classes become more fun rather than just one way, me talking all the time. We now actually can have interaction because we know how to use some of the online tools. So rest assured that the faculty digital skills is being also need to, and it's being done in IMU. Now, finally, it's about assessment, because assessment is very important. How do we conduct exams then if everything is online? So we do online remote examination. So all the students will have to be trained. So before the actual exam, we have a mock session where the students are being briefed on what to do. They can take the exam from home. They don't have to come to IMU, but they just need to have laptop, have two devices. Another one is their phone, so that we are able to proctor, we call it. In other words, we observe you taking your exam, like the photograph that you see down here. Okay, and we are able to see your screen, so that if students, if it's not an open book exam and you're not allowed to refer, we can see your screen, whether you're referring or not. We can see your surroundings. You have to show us whether you've got any notes or books around you. And we have conducted this exam for more than a year, and quite successful. It's been very successful, right? So students can be assured that the integrity of the examination is still being maintained. But in the event that during an exam, your internet went down, your Wi-Fi couldn't work, or your laptop, something happened and so on, we actually have a no detriment policy in place. So under this no detriment policy, you are not being compromised because of things beyond your control. So as long as we have evidence that it is beyond your control, so something really did happen to you, you're actually given more time to complete the exam. But in the case that that is not able to be done, you're not going to get penalized. Okay, so we find other ways to assess you, and you will not be penalized, and you're not going to fail just because your internet or your Wi-Fi did not work. All right, so IMU has put in place those no detriment policy. So how is it like? You might want to know, what is it like? So we actually did the student eye barometer, where all our health sciences students told us what was their experience like last year in 2020 with all this virtual, this online, practicals and all that we're doing. And you can see here in terms of lectures, tutorials, assignment, all are very, very good. All right, so the students are very happy with how we're doing it. They're giving more than 90% of the students say they're very satisfied with the way it's done. Even the learning resources and library is also very good. In terms of tests and exam and group work, it's still also very good. So in other words, we set up channels, team channels, for you to do your discussion with your teammates online, so you don't lose out on that interaction with your friends also, right? So we have been doing quite well. Most students, a majority of students are actually quite satisfied with the way health sciences have converted the teaching learning to online. Now, another last point I want to let is that no doubt all of us are very stressed with the current situation, not only students but lecturers as well, and each of us as individual, because we all work from home, we study from home, so our family members may have challenges and so on. So IMU actually hears our students. So in health sciences, we don't ignore your challenges. In terms of self-learning, we actually make sure that there's enough formative questions for you for your exam. Not only that, IMU also prepares hardship fund for students who need to have, like your family may be having some financial issues due to the pandemic, and you need to get support. IMU has health sciences students actually have gotten the hardship funds as well to help pay for one semester of your fees, or in other ways of supporting you financially. You just need to apply to it, and then Prof Chin is actually in charge. So she can tell you more about this if you have any questions. Then we also have mentor-mentee, of course. All the lecturers are always here to listen to the students and their challenges. And if it really affects them very much, we have our counselors who you can talk to as well. But the most important point for all of us to get out of this pandemic is vaccination, right? So for our clinical students, like nursing and dietetics, for nursing, all our students have been vaccinated fully. And also for dietetic students, about 40 to 50% of them also have been vaccinated. IMU has actually also worked with our partners, the hospitals like HTJ, for example, to make sure that whoever needs to do clinical needs to go to the hospitals, for their placement, which the ministry say is possible, but we make sure that the students get their vaccination as well. So we try our best to facilitate all of that. And you can see now we are to monitor the percentage of students and faculty, staff as well, who are being vaccinated. And it is our policy that everyone should be vaccinated, right? So this is the way to ensure further safety other than the other SOPs that we put in place in IMU. So I guess, BY, that's all that I have to share for the students and the parents here. I hope we get a lot of questions that we can perhaps answer. Thanks a lot, BY. I pass this back over to you.
Hi, Prof. Winnie. Thus far, thank you so much for giving the very brief but very comprehensive description of how things are going in terms of the learning and health sciences. But thus far, I do not see any questions. But maybe we can elaborate a little bit more about. Let's go back to the virtual mobility. I think a lot of times when students, wanting to come into a program and wanting to figure out whether they may be able to do their practical attachments abroad, or whether they can do a credit transfer to a partner school. So maybe you can share a little bit about the credit transfer program. Yeah. From the dietetics and nutrition perspective. Okay.
Yeah. So we have credit transfer for both biomedical science and also our dietetics program, right, to the Australian universities. Now, at the moment, the Australian borders are closed to our students. So we have actually engaged with our students well. And what has happened is some students opt to stay back and complete their degree in IMU, the local program. Some students has decided they even have an option to do both, so they can even, and once the border opens next year, they can actually transfer still, right? So Australia is fine with that. So we actually have a very good system in place where we're going to support the students. Some students decided they will probably just wait out another few more months, and when the borders open, they will go. So things are rather fluid though, as Prof. Chin knows. However, we don't leave them hanging, not knowing what to do. Our international office, Prof. Chin herself being the External Affairs Associate Dean, also works very well with the student to make sure that you either stay back and continue, or you can have both. And next year when the borders open, you can still transfer.
Yeah. I think it's important for students to understand that it is still possible to credit transfer, and the only drawback is we have to rely on the rules and regulations of the college or the university you're transferring to. So for us, we're fine. We will just do what we need to do to help you if you prefer, if you want to credit transfer. We'll do what we can to assist you. And like Winnie said, there will be no detrimental policies that will stop you from going. Okay, we have a few questions. The first is from Anonymous. It says, for non-SPM students, do we need SPM BM for clinical practice for dietetics with nutrition course?
As far as we know, for dietetics, no, we do not have that that criteria. Not like in medicine, they have that criteria, but not for dietetics. Yeah.
Okay. Simple enough. Of course, another simple one is, can I know more about the nutrition course? This is from an anonymous attendee as well.
The nutrition course? Okay. Yeah. So nutrition course is actually meant to train you to become nutritionists. So as nutritionists, you focus on prevention, health, you focus on getting people to eat better, good nutrition. You look across the lifespan from the womb to the tomb. That means from babies right up to elderly. And as a nutritionist, you actually do a lot of empowerment, a lot of advice to make sure people change their behavior and also eat healthier, right? So that's one of the core work of a nutritionist. And at the same time, you also get involved with a lot of public health programs. So as a nutritionist in the nutrition program, you can actually, we will be training you to do a lot of nutrition-based programs with communities and groups. So that's part of the skill that you will get. It's a 3-year program in IMU, and you also do the year you have to do about 6 months of internship with various, not only with the government, but also with various food-related industry. So our nutrition students actually work they get easy employment because nowadays people are very much interested in nutrition, and a lot of companies now hire nutritionists to do wellness programs and so on. So that's where it is, and you become a program that nutritionists are all going to be registered by Health Act. So that means that if any companies or any organization wish to have someone qualified to promote wellness and nutrition, they have to hire a nutritionist. I don't know whether that answers what the person asked about what nutrition is, but if you're not clear, please do go ahead and ask more.
Well, maybe you can basically tell the audience what's the difference between dietetics and nutrition.
Okay, that's always the common questions. So the difference between the dietitian, if you do the course and you do a nutrition course, much of the joint learning happens in the early years, because as a dietitian, you also still need to know about healthy nutrition. The only difference is in the final year and around semester 6 onwards, you start to focus on the clinical aspects, right? So clinical dietetics becomes then the focus. So that will be the difference. So nutritionists will not be covering the clinical part, but the dietitians are the one who will be dealing with people who have illnesses, who require specific therapeutic diets.
Yeah. So one of the key things, like some of the students used to say before, nutritionists are usually working one-on-one, like personal trainers, working with clients, right, outside of the clinic, versus the dietitians are working in the hospitals, making sure that they're getting the normal foods, all the required foods that are required.
Yeah, but they don't just work with hospitals. They can work in the community and with groups and individuals as well. It's not just confined to hospital. Yeah.
Which brings me to the next question, which you can elaborate. What is the career pathway for dietitians? And what will I do and where will I work? So that is an offshoot of your current question.
Yeah. Coming back, sorry, BY, to need for SPM for clinical practice, which I answered just now, to be a dietitian. But I think the entry requirement to our health sciences program, there is some SPM, your SPM entry requirement is there. So just make sure that you meet the minimum entry requirement, not just SPM, but also your pre-university. Yeah. But if you don't have, if you meet those, I think it's biology, chemistry that we need, right? And mathematics, those are the entry requirements. Yeah, just to be clear on that part. About career pathways. So for dietetics or nutrition course. Now, for the dietetics course, the career pathways are mostly because right now, majority of them work with an organization and so on. So they move from being a junior dietitian to a senior dietitian and eventually a head of department. And they can even go up to being head of the non-clinical services. So I've got who are dietitians, who are general managers, even CFOs of hospitals, because of the skill that they have in managing people. So in the government, the career pathway is also similar, from junior dietitian to U44, senior, and it can even be a JUSA, that means one of the highest, similar to like a professor. So you can go up that pathway very well to become very senior. So within about 8 years, most dietitians are already managers or heading departments already. For those who work outside of the hospital, they then do a lot of diverse. If they are working with food industry, they climb up very senior as well in their position. Similarly with nutrition, I have a lot of nutrition colleagues who are product managers, if they work with food related companies, right, and become a senior nutritionist. They do a lot of promotion and for their company, they do go up the career ladder very well. Some also do private practice. So when they go into private practice, they become very well known. And they get invited to a lot of talks. A lot of industry and companies invite them to conduct, wellness programs and so on. So a lot of things you can do in the career pathway for both dietetics and nutrition. I always tell my students, as long as people need to eat, you will have a job.
Yeah, it's for the parents as well as the students in the audience. Gone are the days where, let's say, dietitians have to work at hospitals, nutritionists have to work as a personal trainer, biomedical scientists and medical biotechnologists have to work in the lab. Those days are gone. Nowadays, we have so many other opportunities, and I think a lot of the questions are addressing that. So parents, don't worry. Your parents, your kids will not be, lab rats or clinical dietitians all the time. They have, the world is their oyster. It's not like, Prof. Winnie's time and my time, where the only thing we could do was work in a lab, or her was work in the government, right? So now there are a lot of opportunities, and really let's keep our minds open and continue to explore different possibilities, because kids nowadays, they're exposed to everything on the internet. Your Instagram, your Twitters, everything is shared, so they get to know more, and when they get to know more, they want to know more. The career opportunities, and that's our job in health sciences. We have a career fair coming up next week, so we have all these industry people come in, like what Prof. Winnie was saying. We have all the industries that our students go out to work as interns or as career opportunities. They will come in and virtually, of course, not come on campus, right? They'll come in and they'll share opportunities with your kids, and this is one of the things that hopefully we take pride in, right, Winnie?
Yeah,
we take pride in sharing. And like what Winnie shared with you, the iBarometer, it's a worldwide survey that is conducted every 2 years, where we question our students. We question, meaning we ask them why they like IMU so much. Why is it that they continue to come? And like what Winnie shared with all of you, we really are in the top 90s in terms of customer satisfaction, in terms of learning, in terms of a lot of things. And also, like Winnie and I were chatting just now, a lot of companies, hospitals prefer to hire IMU grads, right, Winnie?
Yeah. BY, I think we have got quite a lot of questions now that have come.
Now it's all
it's all coming. So maybe let's just finish off with dietetics questions, so we can move to biomedical science and the other programs. There's one interesting question. If I'm allergic to food, can I study dietetics and nutrition? Yes, of course you can, because I mean, I assume that you're allergic to a certain, one allergy on food, not that you can't touch food, you get allergic. So that's fine, because there's no issue with that in terms of if you have food allergy. It doesn't mean, in fact, if you have food allergy, understand your patient even more. So, and you also learn how to manage your food allergy. So by all means, it's not a problem for you if you want to study dietetics or nutrition. I think the other questions on NNT we probably have already answered. So maybe we can move on to the next question, BY, on biomedical science, I think.
Okay. There was one on the what is required for credit transfer, right?
Ielts requirement, right, for credit transfer, is it?
Okay. What's the current experience with the latest batch that was scheduled for transfer to the UK? You wanna take this one, or do you want me to take this one?
Which question? Okay, I think let's talk about the IELTS requirement. I think for credit transfer, it's at least a 7.0 if I'm not mistaken. But I'm not. We have to check for biomedical science whether, but usually it's a 0.4 for IELTS for transfer to Australia. BY, are you familiar whether it's IELTS 6.5 is able to transfer?
It's no, it's 7.0.
7.0. That's what I thought. Yeah, it's the same as well for dietetics and for nutrition to deakin. The IELTS requirements a little bit higher. There's a question you said about, what was it that you wanted me to answer?
the current experience with the latest batch that was scheduled to transfer to the UK. But I think you've addressed it in your talk earlier,
right.
that
currently
we have quite a few students who are lined up, but because of what's going on in the UK, some of them have decided to hold on till next year. So you have the option, even though you are scheduled for credit transfer, you have the option of, like UK say no, but you also have the option to say, well, I'm not comfortable to transfer now, right? And that's also okay. That's also it's okay.
I think they have so far, with our experience with partner schools, they have opened the transfer to a year, right? So it's all right. So they give you an offer this year, you can hold on to it until next year. And they understand that it's due to the pandemic, right? So we are having close contact, so not to worry about that. There's also start talking about for credit transfer. I think one of the key, this is for biotech program, one of the key things is your English. And then the rest, I think, is, of course, you shouldn't be failing your semesters. But otherwise, if you do relatively well, it's fine to transfer. Not an issue at all.
Yeah, it's a CGPA of 3.0.
3.0,
to maintain it throughout the first 2 years.
So, not an issue. So far, we've not had any challenge, all our students who wish to transfer, they are able to transfer. The key thing is they don't fail any of their semesters.
Okay, there's a question on, hi, from Anonymous. I'm interested in a postdoctoral program in genetic and cancer. How do I go about that? So
you're the research associate dean, so I let you answer that one.
So Mr. or Miss Anonymous, you're interested in postdoctoral program, so I assume that you already have your undergraduate degree. So if that's the case, you can apply to the postgraduate school, and there is what we call, we have a lot of programs that are involved in genetic and cancer. So if you are interested, just drop us a line and we will be more than happy to assist.
Yeah, I think IMU has a few postdoctorate program. Prof. Leong, Chin, they are the ones who are working in these areas, Prof. Leong Tion especially. I mean, if you're talking about postdoctorate, that means you probably already have a PhD.
Yeah.
Right, this is a postdoctorate. Or is he talking about pursuing a PhD? Either way, IMU you can come, because IMU is quite known for genetics and for cancer research. So just contact postgraduate school.
Okay, then there's another question. Does IMU accept foundation and science students from other universities for the dietetics course?
I think we do.
Yeah, we do. We do. Yeah. And it's subjected to the same rules and regulations.
Please check out the proper entry requirements. If you meet the minimum, we can consider.
Okay. For the nursing program, we have a nursing question.
Good. Practicals.
Yep.
Right. Okay.
No. That's the one. Will the hospital practical be conducted? Yeah.
Yes. So program, because they are governed strictly by nursing board. So yes, practicals will have to be conducted. There is no way that we can not have practicals for our students. What we have done so far is, because of the high cases, there are certain wards that are still allowed for students to go in for practicals. However, because there's concern from the students as well as from their parents at the moment about going into the hospitals, although they've been vaccinated, we have done the theory block first. So this year they are doing mostly theories, and the simulation done in IMU itself, because we've got a good nursing simulated ward. So they're doing that now, and then next year or late this year, when things are safer and the more wards are being opened up, the students will be going into the hospitals for their placement. So this is indeed a very good question. It's very key for nursing. They must have their hospital placement, and that they do get their hospital placement, but in a safe manner.
Okay, along the same lines, another nursing question from Anonymous. At one time, the nurses' supply is saturated in the country. Is this phenomenon still happening in view of the pandemic and private hospitals as seem less patient?
Okay, no, the need for nurses are still not, it's not saturated at the moment now. I think about nursing is a profession where you need to be, there's a lot of empathy. You actually need to care a lot for someone. So for those students who really like to really service, human and do that nursing, you should. We are looking for dedicated nurses, and the country needs more nurses, and in fact more degree nurses. Right now, Nursing Board is saying that they are trying to push towards degree nurses rather than diploma nurses, and I think it's very bright for nursing. In fact, this year we've got a lot of applications of students who want to be nurses, which is really very encouraging. Maybe because the pandemic has also raised the awareness of the frontliners and how important the nurses are. So not to worry to this question. Yes, nurses are still in demand, and in fact, with a nursing career, you can not only do nursing in Malaysia, you're very much in demand overseas as well. So in fact, first few batches of our nursing graduates, they immediately got jobs across the causeway, right? Not just in Malaysia. They get jobs offers even before they graduate. We have hospitals coming in from Singapore, from Saudi, who are looking for degree nurses. It's there. So yeah, by all means, if you are interested to be a nurse, please pursue that passion. We need more nurses.
Yeah, we've always had hospitals from when you were saying from Singapore and Saudi Arabia and also Germany now come and ask for our graduates, I don't want to blow our own trumpet for nursing. Our nurses, almost all of them are employed by very good hospitals. So
even
very
before
happy with that.
They graduate, they have a choice which organization they want to join.
Okay, quick question. Are there any university partners for nutrition or dietetics?
University partners, of course. For dietetics, you can credit transfer to Griffith University at the Gold Coast in Australia, or UON, Newcastle. And then for dietetics, we've also got Deakin now. So you can, which is very well known for their physical activity and nutrition center. So yes, those are the transfer universities to programs.
Okay. Okay, let's switch gears to talk about TNL and student life. Because students can't go to campus, am I right to assume that prospective students don't have to opt for boarding or accommodations?
Okay, interesting question. I would say that if you're out of state, you're out of KL, out of Selangor, and you can't travel from home, you may want to consider coming on board a place to stay, because the chances are once we move into phase 2, we will be opening up more, right, BY? So compulsory practicals and classes will go back on face-to-face. So I wouldn't say that you don't need to get a accommodation. You may have to eventually. So maybe not in the first month, but eventually we think that by October, November, we are going to go, if everything goes well, we're phase 2, then more students are allowed on campus. So we are definitely going to conduct all our compulsory classes on campus.
Yeah, I think parents, all of you, understand by now that, by the snap of the fingers, the rules change. And
so be prepared if you need to come to campus. Yeah.
Like Winnie and I were discussing just half an hour ago that, now that the car washes and hair salons are open this week, and that was done within 24 hours, right? So it's just one of these things that we have to get ready, and like what Winnie said, it's better to be prepared. Just call into student services, make the arrangements for accommodations, right? At least find out about it. Who knows, maybe when the semester starts, the week after, everybody's called back on campus. So that may be an issue. Because the next question, Winnie, is along the same track. Will there be a hybrid mode option to study face-to-face on campus for practicals once MCO is lifted and our students given time to arrange for their accommodations before attending classes on campus?
Of course, definitely. We are not going to say, I don't care whether you're in or out, we're going to do it. We never do that. So yes, students will be given time definitely to get accommodation on campus. before we open up. We always prepare our timetables way ahead. And at the same time, is there going to be hybrid learning? I think that hybrid learning is probably here to stay. The use of online learning can be very useful, right? And it can be very interactive. So the university doesn't intend to just go back to the old ways. I don't think we're going to go back to the old ways. We're going to use a lot of hybrid learning from now on. But when we say hybrid, we don't mean that your practicals are all online. What I mean is essential skills and practicals will be face-to-face. Lectures perhaps will be online, and small group teaching may be face-to-face or online. So it depends on how effective we want it to be and what the learning outcome is. Yeah, because I think we cannot deny that the opening up of the online platform actually allows a lot of opportunities. So I think in health sciences, we don't intend to go back to nothing online, everything just face-to-face. That's not going to happen. We are going to do quite a bit of hybrid.
Yep, and this is direct feedback from some of our students who were in the survey conducted. They suggested that those students who are shy actually get to speak out more.
Speak out more, absolutely.
during these lectures. Why? Because they don't have to show their faces. They can just ask a question without showing their face. All right, or putting in the chat box. So this is one of the benefits of having that as well.
Correct. And it's important, however, for parents out there to understand that when we say hybrid and online doesn't mean that therefore we don't use resources in the campus. We actually do. And we have to beef up our resources on the campus even more, right? To give students. So what the online does is it helps students to actually revisit back those lectures, re-look at it, because it's all now recorded and put on our Moodle. Not like before, if I walk into a lecture, I finish my lecture, what I say in that lecture, there's no other record other than my lecture notes, right? So being online means that students can actually go back and observe that whole class again and learn from there again. So that's what it means. So the resources and the time spent in ensuring that enriching experience in learning does not mean that there's no more investment. There's nothing else we do, right? Everything is just online. It's not like that. In fact, it's more work for us, and we actually invest more because we now have to do micro learning videos that students visit, and they can learn at their own time. So we're actually moving towards personalized learning, where students now can, and even if they're on a train, I've got students on the way on the train saying that I'm listening to your lecture here, but I'm on the train right now on my way, home or coming to campus. But that's fine now. That's the beauty of online learning, and they can always go back and listen to my lectures after that as well, right? So I think that is important for people to appreciate what we mean by hybrid. Not one replacing the other. In fact, it's to enhance. Yeah.
Okay. Yeah. Okay. I was just reminded by the admin that our time is up. Winnie, can you put on the last slide so we can put the yeah.
Okay. Let me just
so for those of you
last slide back on.
Yeah, for those of you whom we didn't get a chance to respond to your question, don't worry. We have this link here that you can just quickly QR code it and ask us any questions or give us any comments, and we'll be more than happy to address them. Okay, so any parting words, Winnie?
I think there were a couple of questions on biomedical science that we didn't manage to cover, BY, but the biomedical science program in IMU, actually don't worry about employability, because all our graduates so far in the past 10 years have actually managed to be employed. It's not only about employing labs, like what Prof Chee said. They also work in a lot of other industries. I think there was a question about that, about career pathway for biomedical science. So I thought we should address that. I hope that I have sort of assured all of you that if you join health sciences IMU programs in health sciences, your teaching, your learning is not going to be compromised. Your learning is going to get enhanced, and all the professions, we are doing our level best so that all our learning outcomes, that we continue to train healthcare professionals for the country that is actually competent, even despite the pandemic. So I guess that's what I want to let everyone know. And we're always here if you have any concerns or you want to clarify, please just drop us a line and we will address your questions after this. Thank you,
Yeah,
BY.
sure. Like what Winnie was saying, we would love to answer all your questions, and we will offline. The admin will gather up all the questions, and we will respond to it. It's not that we don't want to; it's just that we're running out of time. We will address them offline, and hopefully, you will be happy with what we suggest. And I think we will look forward to seeing all of you, right, Winnie?
Yes, definitely. Next,
That's
yeah,
our next
on
intake
campus,
is
hopefully.
yeah, next month is our next intake, and hopefully by that time we will have, like what Winnie was saying, a hybrid mode of learning where some of you will come on campus for learning and some of you will do it online, but either or, this will be the new norm. It'll be mostly hybrid learning now from now onwards, no more face-to-face directly all the time. And this is for our protection and for your protection. So on that note, thank you so much, everybody, for spending your Sunday afternoon with us. I know it's a cloudy day outside. Hope all of you stay safe, and please continue to engage with us because we also want to help you achieve your career goals as well at IMU. Okay, on that note, thank you so much, Winnie.
Thank you,
And
BY.
thank you so much,
Thanks,
admin.
everyone. Stay safe.
Have a safe afternoon. Bye.
Goodbye.